Well, this year's theme is Women and Diabetes. There are currently more than 199 million women living with the disease, and this total is projected to increase to 330 million by 2040. Consultant endocrinologist Dr. Afoke Siawe is in the studio with me to talk more on this. Thank you for joining us at this time. We understand that women in reproductive age are more at risk of contracting diabetes. Why is that?
First of all, the placenta hormone, the hormones produced by the placenta lead to insulin resistance. And so you have a number of women coming down with what we call gestational diabetes, which is diabetes that is first of all diagnosed during pregnancy. And as you can see, the theme for this year's World Diabetes activity is Women and Diabetes, Our Right to a Healthy Future. Statistics show that majority of the women with diabetes in pregnancy are under 30 years old. And we are advocating screening, having access to screening for gestational diabetes, having access to screening for women who are at risk, and then preventing the complications from coming in. And you know, when you target the women, once they are empowered and educated, you are protecting the future generation. They take care of the children. You have a healthy pregnancy outcome, and then they're able to take care of the family better. They teach the children, and things are improving.
Then how easy is it for women to have easy access to healthcare, especially those battling diabetes?
That's the problem. It's not so easy. Like Nomeri said during her documentary, the cost of the medications are expensive. And even before we get to medication, how many women who are pregnant and who have diabetes are being detected? Many hospitals are still not screening pregnant women for diabetes. This shouldn't be the case. Screening should be affordable and accessible to every pregnant woman living with diabetes. And even for the women who already have diabetes and are planning to get pregnant, there should be some form of preconception counseling and planning so that the pregnancy outcome is better.
So what should be the focus now, and from which institution? From the government, an action plan from the government, or from medical practitioners to spread the awareness, and then like you said, ensure that those pregnant women are screened during their gestation period? It's
teamwork, which starts from the primary care level. It's not only the government, but the government and the public sector, private-public partnership. So advocating screening from the primary care level to pick up women with diabetes early. And not just screening, putting enabling environments to make sure the risks are reduced and fewer women come down with diabetes.
But is it even preventable?
Oh yes, up to 70% of the cases of type 2 diabetes are preventable with lifestyle, healthy lifestyle, weight control, exercise, preventable.
But is it curable?
For now, diabetes is not curable for now.
So that brings me to the question of patients having to live by using insulin, which of course I understand, according to the report of our correspondent there, that is quite expensive and even scarce in the first place in the country. Yeah,
you know, we don't produce a lot of things in here. So one of the problems is we don't produce insulin in Nigeria. We import everything that comes in. So by the time you factor in import duties, storage, insulin has to be stored in a cold environment, the cost of insulin goes up. And for the pregnant women with diabetes, right now it's insulin we give to pregnant women with diabetes.
But then they are resistant to it because of
there's insulin resistant, but that is what is used to treat the pregnant women with diabetes because it's the safest medication for the unborn child and all that. So it's not readily available in the sense that it is expensive. And most people pay out of pocket because the health insurance sector today, the way it is, covers less than 5% of the Nigerian population. So you can imagine the individual bearing everything out of pocket. So if, from the government point of view, if they can cut off all these import duties and all these taxations on the products, it will reduce the cost of insulin by the time it's getting to the common man on the streets.
In that report as well, an endocrinologist said that it's not about what a patient eats, it's about the insulin not working right.
Okay, let me just, there are three main types of diabetes. You have the type 1 diabetes, in which the body doesn't produce insulin at all, and those individuals are dependent on insulin. They need insulin to survive. And then you have type 2 diabetes, in which the body does produce insulin, but there's some form of resistance to the body's working of insulin. And then you have gestational diabetes, which is diabetes that is first diagnosed during pregnancy. So in all, you need insulin at various stages of care for the 3 groups of persons living with diabetes.
And as the world is commemorating the day, what should be the focus generally?
The focus should be preventing diabetes, especially type 2 diabetes. Most of the people with diabetes in Nigeria and worldwide have type 2 diabetes. The key is prevention. It's alarming that we're having children coming down with type 2 diabetes today, and it's all because of our lifestyle. People don't exercise, people are gaining weight, and people have a family history of diabetes, and people are coming down. And you see people getting blind and having amputations and all that. So prevention is the key. Exercise regularly, eat healthy, and keep a healthy weight.
And the symptoms again, could you tell
us? The main symptoms: frequent urination, weight loss, excessive thirst. But having said that, over half of the people with diabetes do not have symptoms. Yeah, they're picked up when they go for cataract surgery, or they have a sore that doesn't heal. And that's why during this period we advocate screening, especially if you're at risk for type 2 diabetes. If you have a family history, your father, your mother, your brother, your sister, a grandparent, or if you're over 40 years old, or if you're overweight, you should be screening for diabetes regularly.
All right, thank you very much for the analysis, and of course the need for people to take their health seriously. Dr. Afoke Siawe, you're an endocrinologist. Thank you for coming to the studio.
Thank you for having me.